Welcome, everybody. We're just waiting for everybody to join before we get started, so just hang tight.
All righty, we're going to go ahead and get started. So good afternoon. My name is Ashton Driscoll, and I am the LTSS Senior Provider Relations Specialist with OMPP. And I would like to thank you all for joining us today for our Pathways HCBS Provider webinar, focusing on member enrollment. Some housekeeping items for today. Everyone who is not presenting will be muted during today's presentation. There is also a Q&A box where you can submit questions during today's presentations. Those questions will be recorded to inform our FAQ that is located on the Pathways website, which you can find at in.gov/pathways. This FAQ gets updated regularly, and we encourage you to check that out and continue to send in questions as well to backhome.indiana@fssa.in.gov. That link will also get posted at the end of this webinar. I also want to let you know that this webinar will be recorded and posted to the Pathways website under the Stakeholder Engagement section. I am now going to hand this over to my colleague, Kim Bremer. Next slide.
Thank you, Ashton. Thank you for attending this webinar today. We're just going to kind of go over the agenda of what we're covered today. First of all, we'll do an overview of what exactly Pathways is. Then I'll pass you along to Clarissa to review our member enrollment activity. And then we'll end with supporting our clients, the clients you serve, and then end with the Q&A process. We're going to move on to the next slide. There. The overview for Pathways. The next slide. Why is this reform currently happening? First of all, we have a significant growth in our population, 60 plus in Indiana, and we have determined that they have a kind of a disjointed system. And by reforming, we're hoping to gain and to be able to anticipate and coordinate and cover the growth that we will be having in this program by increasing choice, also by managing the cost and increasing quality. The next slide. So what is MLTSS? It is a delivery system where we're using managed care entities, which is what we call as MCEs, to coordinate the medical care and long-term services and support our long-term care services here for those who are enrolled in Medicaid benefits. Indiana has introduced a new program for those Hoosiers that are Medicaid eligible 60 years and above, and it's called Indiana Pathways for Aging. Enrollment in Pathways officially begins this spring, which is why we're having this seminar today. The MCEs participating in Pathways will deliver acute preventative services as well as home and community-based services and nursing facility services. Next slide. Indiana Pathways for Aging is offered more choices by allowing people who get nursing facility level of care to get services in a community setting or in facility setting. Pathways members will choose one of 3 MCEs. Those are our health plans. It will be either Anthem, Humana, or United Healthcare. Each MCEs will offer the same Medicaid health coverage for the medical expenses such as doctor's visit, hospital care, therapy, medications, prescriptions, and medical equipment. They will each offer a care coordinator to assist and coordinate the benefits and medical needs. They will also offer will offer service coordinator to assist with the coordination of care. They can offer different special add-on benefits, which we consider are enhanced benefits, such as gym memberships, gift cards for groceries or household items, and those would differ between the plans. Next slide. So Pathways offers members a lot more support. The goal of this is to, as we said, to increase care options. And in doing that, you will have different points of access. The member will have an enrollment broker who will help them choose which managed care is best for them. They will also have a care coordinator that is provided by the MCE to support the member's health needs. They will also have a service coordinator that will also support all of the waiver needs as well. They will have assistance in navigating the Medicare Medicaid benefits, since a lot of the people who will be in the pathways will be those dual eligible. We also have another layer of support for member support service vendors for those who are providing care for those getting services. Next slide. So in conclusion of our overview of what pathways are, I'd like to pass it along to Clarissa, who will talk about the member enrollment activity that is currently happening.
Thank you, Kim, and good afternoon, everyone. My name is Clarissa Lovell, and I am the Indiana Pathways for Aging Program Manager. And I am going to speak on the enrollment activities that will be happening in the next few months as we make our way towards Pathways Go Live. Next slide, please. So this slide provides you all a high-level time frame of what to expect as we move towards Pathways Go Live. So February to March of 2024, members will begin to receive plan selection notices from the enrollment broker. And also, the members who are residing in a nursing facility and receiving HCBS services will begin receiving phone calls from the enrollment broker, letting them know that they can select their Pathways plan. And we will actually have later in the presentation some examples of those notices that future Pathways members will be receiving and that your clients will be receiving, so you have those for your records later in the presentation. And then March through April 2024, members can continue to make plan selections. So during that time period, members can use the information that was received on those initial notices to call the enrollment broker and make their health plan selections for the Pathways program. May 2024, if the member does not select a plan, then they will be auto-assigned to a health plan. Members receive also a 60-day notice of Pathways enrollment with plan benefit and contact information for their health plan at that time as well. And in June 2024, members will begin to receive a welcome packet from their assigned health plan, and the welcome packet includes items such as their member ID card and contact information and some benefits to the health plan. And then July 1st, 2024, that is when Pathways coverage becomes effective. And those who are transitioning from fee-for-service and HCC, which is Who's Your Care Connect, who are 60 years and older, will go into the Pathways program. Next slide, please. So as I mentioned earlier, going through the timeline, we wanted to include some draft notices for you all to review so you have an idea of what will be sent out to the members as we approach Pathways Go Live. So here is a sample of a member notice for those who are currently receiving HCBS services. And this is the front of the notice, and inside the notice you will see that it will call out the member's name, and it'll have their address, and it'll also state a date to where they need to select a health plan by, or they will be assigned. The notice also goes into details about who the health plans are for Pathways, which are Anthem, Humana, and UHC, and it instructs the member to call the Pathways helpline, which is the enrollment broker, if they have any questions or need assistance choosing a health plan. Next slide, please. So this slide just shows you additional context that is also in the notice. The notice goes over what is Indiana Pathways for Aging and provides a brief overview of what the program is. It also describes what a health plan is, and it also directs the member that if they need or want to learn more information about the program, it again provides the enrollment broker helpline for the Indiana Pathways for Aging program, as well as the Pathways website link. And we also have a disclaimer at the bottom that if a member needs to be provided materials in other languages, they may do so through the helpline at no cost to them. Next slide, please. Another example of a letter that your clients or future Pathway members might bring to you all might be a client that is enrolled in an aligned DSNP. And this is an example of the notice that they will receive. And we will go into more context of what aligned means later in the presentation. But you will see that with this notice, again, the member's name and their address will be included. But this notice calls out who the member's DSNP plan is. So the health plan that they are receiving their Medicare benefits from, if they are duly eligible, it'll call that out here. And in the yellow text, you'll see it'll either be Anthem, Humana, or United Healthcare. And the other yellow box there will also populate to who their Pathways health plan will be. So for example, if that yellow box there says Anthem is their current DSNP health plan, then their Pathways health plan and that yellow box will also populate to say Anthem. And please keep in mind that the yellow boxes will not be there whenever these notices are mailed. They're just there for context and for demonstrations in the webinar. And you also see in this notice as well, there is another insert box that's yellow for the date, which will instruct when the member needs to select their health plan by, if they decide to choose. So in this notice, the Pathways health plan has already been picked for the member to help to ease in the transition. But of course, the member always has the option if they would like to call and change their health plan for Pathways, they can do so. And again, it states who those health plans are, Anthem, Humana, and United Healthcare, and has the Indiana Pathways for Aging helpline number to the enrollment broker. Next slide, please. And similar to the other notice, we have on the back of this notice, again, a description of what is Indiana Pathways for Aging and what is a health plan. But something different that is not on the other notice, we help the member understand what a dual special needs plan or DSNP is, just in case they are confused by that wording in the notice. And also we call out that if the member needs to know more information, of course, they can call the Indiana Pathways for Aging helpline. They can go to the website, but we also include SHIP's number as well if they have any questions about Medicare. And again, the member can call the helpline if they need any materials in another format at no cost to them. All right, next slide, please. All right, so what is an aligned plan? So as we saw with the previous notice, it is for those members or those waiver clients who may have an aligned DSNP. So whenever we speak about aligned in this context, we mean that an aligned plan in Pathways is an enrollment with an MCE that also operates a dual eligible special needs plan, which is a DSNP, to provide Medicare benefits. So it's available for people who have both Medicaid and Medicare in this context, so AKA those dually eligible individuals. So Pathways members who have decided to join a DSNP run by Anthem, Humana, or UHC for their Medicare benefits will automatically be enrolled in the same Pathways MCE. But again, members have the choice to enroll with another MCE if they feel that it is a better fit for their care. And again, we did this alignment in order to ease in the transition for members. And also, we wanted to better assist with the coordination of care. If a member has the same health plan for both their Medicare and Medicaid benefits, there's better coordination, not only for the members' health care, but also for providers as well when needing to help coordinate that member's care for their needs. Okay, next slide, please. So what I alluded to a little bit earlier, why stay in an aligned plan? Why do we want to encourage individuals that if they have an aligned plan, why is it beneficial for them to stay with that aligned plan? So a person in an aligned plan gets coverage by both Medicaid and Medicare through the same parent company. So the member will get one ID card, so that will assist with the ease, and have one member service number, and will have one unified grievance and appeals process. So the member will not have to juggle multiple processes for multiple health plans, whether it's Medicare and Medicaid. And most importantly, the aligned health plan will connect medical and community supports that a member needs. So they can also help a member get access to services not covered by Medicare. And Kim touched a little bit on that earlier in the presentation. Okay, next slide, please. So although we spoke about alignment, again, we really want to focus on the member choice. And members always have a choice in their Pathways MCE. So I'm going to say this again because it's very important. So members always have the right to choose a different Pathways MCE. So if they do not choose, that's when FSSA will assign a member to an MCE. If they don't have an aligned plan per se and they don't choose, or if they want to switch, then if FSSA needs to step in, then we will assign a health plan at that time. But of course, the member can call at any time and switch their health plan. And whether the member they choose or assigned, the member has the right to change their MCE. And we wanted to list the reasons how and when a member can change. So some of these points are at any time before the program goes live. So here we have July 1st, 2024, within 90 days of enrolling in an MCE. So before September 30th, 2024, annually at the open enrollment, which is that Medicare open enrollment timeframe. Anytime a member's Medicare and Medicaid MCEs are unaligned, so if they do not match, if they have two different parent companies, so I get my DSNP care through United and my Pathways MCE is Anthem. At that point, I can decide to change my DSNP to Anthem if I feel, or I could change my Pathways MCE to UHC to match. Once per calendar year for any reason, or any time using a just cause process. And a just cause process might be, I feel like my providers in this network is not providing the care that I need with this health plan, I would like to change. And at any of these points, the member would call the enrollment broker to facilitate any of those changes. All right, next slide, please. And with that, I will now transition over to Charity to speak about supporting clients that you all serve. Thank you.
Thank you, Clarissa. I'm Charity Lumpkin. I'm the Member Experience Manager with the Office of Medicaid, and we'd now like to share how you as a provider can support the clients you're serving during this process. Next slide. Educate, explain, and assist. So the most important thing you can do is to remind them of the change coming in July and what that means for their services. They will still have access to the same benefits as well as enhanced benefits that they can view in their health plan comparison. You can also explain that specific letter that they're going to receive. Those letters are going to start coming out. So assist them in explaining those letters and remind them to keep the mail that they receive from FSSA, as it could be pertaining to this pathways change. It would also be helpful to keep the enrollment broker phone number on hand, as well as access to the Pathways website. The more we can all keep members informed of resources available, the better. So we've got the pathways number there at the bottom. Next slide, please. Another element of enrollment that you can help a member with is ensuring that they have all of their information available before calling or accessing the website to help them with this process. This would include their Medicaid ID number or Social Security number, the correct information on file with FSSA, so making sure that their address, phone number, date of birth, all of that information is accurate with FSSA and DFR, that they know their primary medical provider and their waiver service provider. While the MCE will have access to the open network, many members will want to work with an MCE that has their providers in the network. That's why we're encouraging them to know that information. I'm going to now pass this back to Ashton to finish this out.
Thanks, Charity. You can go to the next slide. So we encourage you as a provider to check out the Pathways website on a regular basis. If you go to the next slide, this will have updates to the FAQ as well as updates and resources available. It's also a great place to send members to get more information as well. There are a couple tabs there. There's Pathways providers, but there's also a section there for members and caregivers that you can send your members to. Next slide. There is also an FAQ available that's specifically aimed for Pathways members that talk about things like the Go Live, general program things, health plans, coverage and benefits. Next slide. And there is also an FAQ available that is specifically aimed towards HCBS providers. A lot of the questions that are currently being put in the chat are actually answered within that FAQ already, so please make sure you're checking those out. Those do get updated as well. Next slide. We'd also like you to encourage you to send in your questions to the back home inbox for questions that weren't answered today, as well as questions that you might have in the future. This inbox is monitored by our team, and some questions will get added to our FAQ that is all available on the Pathways website. Next slide. We wanted to thank you all again for taking the time to join us today and learn a bit more about the member enrollment process and your role in supporting your clients during this transition. As a reminder, we will be recording all questions submitted today to inform our FAQ for the Pathways website, again located at www.in.gov/pathways, where you'll also be able to find a recording of today's session as well as the slide deck. These should be available in about a week under the stakeholder engagement section of the Pathways website. I would also like to invite our HCBS providers to consider joining our Facebook group focused on sharing resources and building a community together during this transition. You can find that on Facebook by searching Indiana Pathways Provider Community. I wanted to thank you all again for your continued work in our state and your active participation in these events, and we look forward to seeing you all at the next one. Thank you so much.